Are you still assessing your patient's muscle function just by eye? Many physical therapists still base their assessments on observation, palpation, or the patient's subjective responses. The problem is that these methods don't always detect what's really happening beneath the skin. Muscle compensations, activation deficits, changes in muscle response time. And these factors could literally be limiting the progress of your treatment. How many times have you designed a treatment plan that didn't deliver the results you expected? How many patients have come back to your clinic without clear improvements or even with new symptoms? Without an evaluation based on objective data, it's easy to overlook key details, and those details are what make the difference between a quick recovery and a chronic condition. Surface electromyography is a tool that lets you see the invisible, to know which muscles are working well and which are not. Would you like to identify which muscles are functioning the worst, design individualized treatments, and communicate progress to your patient more effectively? Then keep watching this video. This guide is made for you. Electromyography is a non-invasive technique that records the electrical activity of muscles using electrodes placed on the skin. In short, it allows you to hear and see how and how much a muscle activates in real time as your patient moves. Thanks to it, you can objectively assess muscle function, detect compensations, asymmetries, or activation deficits, and of course, make more informed clinical decisions. Why should you use it in your practice? Some of the most notable benefits include more accurate diagnosis, because you'll detect inefficient muscle patterns that aren't visible to the naked eye. Choosing more effective exercises, as you'll adjust the load, angle, tempo, and technique based on actual muscle activation. Greater patient adherence. By showing objective visual data, the patient better understands their problem and becomes more engaged in the treatment. But how does electromyography work step by step? Its clinical use is very simple. First, you place the sensors on the muscles you want to measure. For example, the gluteus maximus, the vastus medialis, the upper trapezius. Second, you record the muscle signal with synchronized video. This allows you to analyze movement and activation simultaneously, making both diagnosis and explanation to the patient easier. Third, you interpret an intuitive graphic report that shows you, for example, if the gluteus is activating less than the lumbar muscles during a deadlift, or if there is excessive coactivation of the upper trapezius when, for instance, there is a shoulder flexion. And where can you apply this? Well, electromyography has multiple applications in physical therapy, both in the sport field and in the clinical field, as well as in the musculoskeletal area. That is low back pain, tendinopathy, scapular instability, iliotibial band syndrome, in the area of pelvic floor, postpartum re-education, urinary dysfunctions, pelvic pain, crucial in neurology, in stroke, cerebral palsy, Parkinson's disease. Very interesting in the area of TMJ, for evaluating muscle hyperactivity in bruxism, headaches, or temporomandibular pain. What does it offer compared to other methods? You provide assessments based on objective data, not just perception. You gain credibility by showing graphs that the patient instantly understands. You set yourself apart professionally, positioning yourself as an evidence-based practitioner. You design more precise and personalized interventions. Therefore, surface electromyography is not the future, it's the present of advanced physiotherapy. Thanks to this tool, you'll be able to measure, analyze, retrain, demonstrate progress, and communicate. And most importantly, you'll be able to help your patients better. See you in the next post.